There has been a lot of history with regards to instrumenting orthopedic devices, and I've become interested in this because, particularly in external fixators, that is my area of expertise, there is a lot of disparity between different people doing the same thing, and we don't know why that is. Is it because people don't do what they say they're doing, or is it that our measurements are not very accurate? So there is an opportunity here to look exactly what is happening to the patient and what is happening to the device during the period of treatment. And hopefully that'll inform me and my colleagues on how we can change what we do and improve what we do to make it better for patients and for us as clinicians. Instrumentation of devices does bring benefits. I think the benefits for the provider of healthcare is more efficiency and cost savings, particularly on reducing the number of interactions and investigations, particularly ionizing radiation, X-rays. And the benefit to the patients are going to be reduction in their burden of the time that they invest in interacting with healthcare providers. So reducing the number of times they come back to clinic and actually making the times that they come back to clinic for particular clinical reasons, making it much more beneficial to the patient. The question is always, well, new innovations, where do they lead in the future? And I think some of those questions we can't answer because maybe we'll find out things that will inform new innovations. So it's the unknowns. But one of the things is I want to make the patient journey better for the patient, and I want to make more efficient use of my time in looking after patients. And hopefully that'll lead to cost savings and lesser spend on the generality of healthcare. An interesting prospect is to think about what the future brings from innovations like this. It could be that similar technologies can be used in all sorts of orthopedic interventions, looking at patients with shoulder problems, elbow problems, knee problems, even spine problems. There are innovations that we do know will help, and part of it is going to be the cost savings that you have in the NHS in particular. If patients are more aware of how they are continuing along their rehabilitation journey, maybe we can intervene better at various time points and give them better feedback so that we can improve that journey for them and improve their rehabilitation.